Hi, I am here to give a short introduction on the physics and basic principles of sonography. Here follows the snippets of all the topics in the lecture videos. Please go through them. Having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in. Of the direction from left to right, so it is red towards the transducer, whereas here it is from left to right. This is left to right with the spine here. So as a result, the flow is towards the transducer. So how is this possible? The same structure, how it is appearing red, here it is blue. That depends on the direction we know. Any vessel, if there is no flow, you must think of this point that if it, what you get red in the pulmonary artery because the pulmonary artery is at an angle of 75 degrees. Here the spine is posterior. If you make the spine anterior, then the flow is going to be towards the transducer. So main pulmonary artery and both branches will appear red. Okay, is it clear? So the same shown here, but if you make it a lateral approach, what happens? The pulmonary artery is blue because it is away from the transducer. Then the right branch is red because it is flow from the bifurcation towards. We have seen the branches from lateral approach, the branches appearing in different colors. But here you see both the branches are in same color, red. So this is left, this is right. So how can both the branches appear left in longitudinal breech presentation? Then the flow becomes blue because again this is left, this is right. So the flow is from left to right. Here also left to right, but it is towards the transducer. It will happen when these are venous tributaries, both go and join the main vein and flow is. So this is right pulmonary vein blue, left pulmonary vein red. Okay, they join. So here with two colors in fetal echo. So how does it happen? Now this is example. This will become perpendicular. So you will see that there are two vessels. If it is compressed, you see the interface between them in both these. So the confluent vein ascends up by the side of the left SVC and joins somewhere in the root of the neck, the upper part. So when you make a sweep, joins the vein. So this is AV fistula. So this explanation of the color Doppler physics helps us to make this diagnose, solve rare situations like the TAPVC confluent vein ascending up by the side of left SVC and joining it, which is very rare. Okay, so but this